drive up here. It's such a pretty countryside. I almost pulled to the side and I wasn't going to make it. I was just going to sit out and eat my breakfast, but what a beautiful part of the country.
I would have found you.
She must know my wife. My name is Barry Darrell Peel, and I am, and Julie, I am ready to.
Okay.
My name is Barry Darrell Peel, and I am with the U.S. Small Business Administration. The U.S. Small Business Administration is responsible to stimulate the economy through the support and growth and development of small businesses. With that being said, because the Affordable Care Act is such an important issue right now, the President has ordered that the Small Business Administration come out and help with some of the misinformation that's out there due to the political rhetoric and some of the media slants on things. So my job is to tell you the facts, tell you where you can go and research on your own, and where you can constantly get updates. I am an economic development specialist with the Columbus District Office. We are responsible for the lower 66 counties of the state. I'm also the veteran rep. Do we have any veterans here? Just you, sir? Okay, two? Okay, I want to make sure that I shake both of your hands today. Thank you for your service. I am a 21-year veteran also. What branch?
Navy.
What branch?
Air Force.
Hey, hi. Sorry. 21 and a half years of the Air Force. I also have a son that has just hit 20 years and is made chief in 20 years, by the way. For those of you that don't know, that's a very significant accomplishment. So, we're here to talk about Affordable Care Act. So how many of you are experts in Affordable Care Act? Neither am I, okay? However, since I've been tasked since February, I've probably done at least 20 of these presentations to over 1,000 different businesses, companies, or organizations. Excuse me. So with that said, what we're doing today, I broke up the presentations, so everyone here should be employers of less than 50 employees. Is that correct? Yes? Anyone close to having 50? By how many?
3. I'm probably right there.
Okay, so I'll talk a little bit about that as we get closer. You might even want to come for the second session because I talk about things that are specific to those that have 50 and above and those that have less than 50, and then there's a little cushion for those of you that are close, and I'll kind of mention that a little bit. So, Affordable Care Act, it's the law. I'm not here to debate whether we should have it, whether we shouldn't have had it. Basically, I'm here to talk about what it is and what its impact will be on you as a small business and your employees. So the Affordable Care Act is actually broken down into 3 specific areas. There is the individual shared responsibility. Starting January 1st, 2014, everyone has to be covered somehow or another under some sort of insurance, either employer offered, your spouse, Medicare, Medicaid, TRICARE if you're from the military, but you and your family must be covered. That's the individual responsibility. I'm not going to talk much about that because I'm going to talk about businesses, but I must touch it because you as business owners want to be responsible to talk about what we call the exchanges, where people can actually shop and get what we call affordable health care. Then there is the employer shared responsibility, and that is for those employers that have 50 or more employees that must offer some sort of insurance to their employees, or they may be subject to a penalty. So that means since you have less than 50 employees, that means you are not subject to those penalties. Did you know that? So we can get a big exhale right now. So no one in this room right now is subject to penalties under the Affordable Care Act if they do not offer health care insurance to their employees. In fact, none of you in this room have to offer health care insurance to your employees. However, there are some tax incentives and some benefits if you do, and I'll talk about the reasons of why we do that. The third part is the insurance agencies' shared responsibility, and they carry the biggest load. Obviously, we're all aware that we've been in an economic downturn, and we've been trying to come out of that, and a lot of that has to do with the debt and the rising health care costs. And this isn't a new issue. This has been forever that we've had this issue. Well, you remember way back when AIG and those other insurance agencies went defunct and the government had to come in and bail them out? Well, they bailed them out, and now those companies are making record profits, so they have to share a responsibility in this Reform Act. Okay? Julie? I think you might skip. Thank you. So, how many of you already offer some sort of health care insurance to your employees? Those of you that raise your hand, why do you do that?
It's a benefit to get employees to work for us.
Anyone else?
You want to get less employees.
Anything else? Absolutely. It's a competitive advantage to you as a small business to be able to offer health care to your employees. I mean, this is how it happens. You look for a job, you find a job, put your resume together, you put it in, you're selected for an interview, and then you get that call from their HR saying, hey, congratulations, we'd like to offer you this job. This is the salary we're going to pay you. And what's the next question that you are interested in?
Benefits.
What are the benefits? Primarily, what are the health benefits? Sure, we want to know vacation, we want to know other incentives, but primarily, what are my health benefits? With that being said, currently small businesses have to pay almost 18% higher rates for the same insurance that a larger company like Honda would have to pay for the same exact insurance. That's because the way that the insurance industry does it right now is that they make these risk pools. So if you have a small business, you only have 5 employees, and 2 of them are women of childbearing age. One is an elderly woman, another is an elderly man. The way that they assess that is that makes you a very high rate risk pool. So your rates are much higher than those others that can spread that risk across 1,000 different employees. Therefore, most of the time, you don't offer health care insurance. You cannot have that competitive advantage, to be able to, grow your employees, teach them, train them, and then all of a sudden, another company comes along, they're offering health care insurance, they're matching your salary, and they're gone. So small businesses have a lot of trouble trying to grow. So currently, you pay somewhere 18% or so higher, and that's variable, that changes. Well, now the Affordable Care Act has come into play. And, as I said earlier, these are some of the obstacles that many of you face today. In fact, by the way, I want to congratulate those of you that are already offering some sort of health care. I usually do not get a lot of businesses under 50 that are already offering some sort of health care insurance. But too few choices, the premiums were high, they would keep fluctuating. There were high rates for women, elderly, chronic diseases, and there were waiting periods, or you wouldn't get coverage because of pre-existing illnesses. These were major, major issues that happens for anyone that's trying to get health care insurance. So today what's going on is that the insurance industries, they face a limit on what they can do with the premiums that you pay. Currently, they're paying probably 40% of your premium dollars on your benefits. Starting January 1st, they must pay 80% for your benefit on your premium benefits and only 20% on administration. So that's going to reduce their ability to pay high exorbitant bonuses to their CEOs. They're going to have to find that another way. They want, the government wants them to be able to pay on your premiums, on your benefits, on your health care, and also to improve the quality of the care that you receive. Starting in 2014, all insurance companies must disclose any rate hike that's over 10%. So what's happening right now? A lot of insurance companies are trying to jack their rates up now, and they're trying to absorb the fees that the government is charging them to create pools and funds for Affordable Care Act, and they're trying to pass it on to you. However, let me assure you, as that's happening right now, Washington is also doing some changes to legislation for those companies that are doing things like that. Because the whole idea is to make insurance affordable, reduce the rates, reduce the responsibility or the issue that hospitals and doctors have where they have to jack their rates up real high because insurance is paying so low. So the idea is that they won't have to jack their prices up. Those prices will start to come down and they'll settle, and you'll get more benefit out of your premiums. Starting in 2014, they can't charge higher rates or deny coverage because of pre-existing illnesses. Now, I'm seasoned, and coming out of the military after 20 years, you know, I have all kinds of things that are wrong with me, you know, diabetes, high blood pressure. So insurance companies can deny me coverage, but they won't be able to do that anymore. Children that have, you know, kidney disorders, so it causes growth problems, or they may have autism, they could be denied insurance. That won't happen anymore. Can't charge higher rates for women or additional premiums because you have an organization that is dominated by women, especially those of childbearing age. This was a big issue in the insurance world because they would charge higher rates because they're assuming that if you are of childbearing age, you one day will have children, which means that you'll have some sort of exorbitant health care costs. Basically, as I explained, that it will pool the risk amongst a lot of small businesses instead of just one small business. So now you'll be thousands and thousands of potential clients, so they can spread that risk out amongst all of those groups instead of your single group. They can no longer have dollar limits on coverage. So, you know, some of the insurances, and help me out if anyone wants to spit in, but they may have a $10,000 annual catastrophic cap. So that means that once you have used up $10,000, you're done. So if you have something major like cancer or some major injury that has happened, you know, once you get to that $10,000 cap, you're on your own. They can no longer have those caps. Once you're insured, you are insured. And all insurance companies must have an essential basic plan. And basically they must have preventative health, they must have ambulatory, emergency room. So there's just whatever you would get from a major company's insurance, these are minimal essential for all insurances, especially the insurances that you'll be able to purchase in what we're going to call the shop or the exchange. Also, some of that coverage is going to be for dental and for vision for children. So your children will have dental and vision in their plans. You may have to pay or get another plan to supplement for vision and dental, but basically all plans will have to have those minimal essential coverages. So since 2010, those of you that have already offered healthcare insurance, you are eligible anywhere up to 35% tax credit for the premiums that you pay for your employees. How many of you have taken advantage of that? So you're aware. So there were a lot of other hands that went up that somehow or another, because we're late getting out here and passing this information, you missed the opportunity for this 35%, because the last year for it is this year, 2013, so you can get it next year when you file your taxes. Next year, that's going to jump up to 50% tax credit for your payment, your premiums that you pay for your employees if you purchase insurance out of the shop or exchange. And I'll talk a little bit about that later on. And you'll be able to do that for 2 consecutive years. So this is an attempt by the government to help you with the costs that you will be paying in for your employees to get covered. Now, not only are you eligible for up to 35% tax credit, but the rest of the premiums that are left over that you pay is tax deductible. So it doesn't actually cost you anything. It becomes a cash flow possible situation. So now as we're talking about these health insurance marketplaces, you'll hear them referred to as the shop, as the exchange, as the marketplace, and that's because they all do different things, whether it's individual or whether it's business. However, it's all one giant pool that will be authorized and organized, and I'll talk a little bit about that in a minute. So far, 6.6 million young adults will be covered through their parents' insurance. And with the new laws, those children will be covered up to age 27. So now I know when I was growing up and my children were growing up, you know, the way it was that they were on my insurance until they were age 21, unless, or it just depended, 18 or 21, unless they were in college, then it could go anywhere up to 23. After that, they were on their own. Well, of course, so that meant most young folk were not getting insurance unless they went to a company that offered healthcare insurance. So any lingering or small issues that they had health-wise was not being covered, and eventually it can grow into something else. So now they'll be covered under your insurance all the way up to age 27, and that will be for all insurances. 17 million children cannot be denied due to pre-existing illnesses. That surprised me. I mean, I didn't know what the numbers were, but 17 million children have some sort of pre-existing illness that can deny them access to health care insurance, which means that the parents now have to carry that burden somehow or another. 15 million Americans can no longer be dropped because of catastrophic coverages or limits. 6.1 million seniors have saved over $5 billion in prescription costs. And this is the big part right here, this electronic records reform. So starting in 2014, all insurers, all doctors, all hospitals will have to have everything they do in electronic format. So what that should do is that should reduce the administration costs. It should expedite the claims that you have because everything is done electronic. All right. So, yes?
You talked about the electronic reform. So who pays the small doctor to implement that system into their business?
I'm not sure who is going to pay for it. However, since you are small businesses, I'll put on my SBA hat. Sounds like opportunity. Sounds like there will be some sort of opportunity for those of you that are maybe in the IT field or claims benefits. So a lot of that stuff is going to happen, you know, through your support agencies. So your health claims benefits, the hospitals, so forth and so on. And if are you a doctor?
No, I just heard doctors say that there are a small office that the government's requiring them to put out about $250,000 to.
Is that what the numbers are looking like?
And they don't have that money to do that.
Bill, I'm not an expert by any means, but the federal government, there is some reimbursement based on, for instance, the health department's looking at electronic health records. The hospital's already, and the physicians here have already gone to them. It kind of depends on what you buy, what's best for your practice, and bases it on some on your Medicaid and Medicare percentages, but mostly Medicaid. So there's federal reimbursement, but it does not, you're right, it does not cover the entire cost of what it's going to cost the health department to implement it.
Did that answer your question, sir?
I kind of anticipated that answer,
Well, you could have stood
Well,
up and
yeah.
and made it as a statement.
Yeah, in other words, nobody really, it's still going to go back to the doctor to figure out how he's going to charge his patients and he's capped on what he can get anyway. He's
Yeah.
got to squeeze that out of an already tight budget.
Yeah, I'll have to research that some
Well,
more.
the idea is that there'll be cost saving somewhere along the line. Yeah,
That's the theory.
yeah.
Right, I mean, but if you're a single doctor office
Right.
with one administrator, and that's how your practice has been operating, I can see how suddenly that would be cost prohibitive. Now, keep in mind, you don't have to offer health care insurance, but if you're in that field, you will have to do some shared responsibility, which would be the electronic records. But I'll follow up on that, and obviously when I come back, because I will have to come back, because this law is changing, there's a lot of moving wheels. There will be legislation and there will be litigation about Affordable Care Act, so there will be changes, so I'll have to come back periodically to update, and I'll give you also some sites that you'll be able to follow those updates on your own. Any other questions to this point? Yes, ma'am.
In another direction, I have an employee who's on his parents' plan, and his mother works for the state and has great benefits, and he would rather take the higher wage and not take insurance from us. Do I have to offer him insurance?
You don't have to offer him insurance. He has to have insurance. So if he opts out of an insurance that you offer him, then he'll be able to go out into the shop. Or he doesn't have to buy it from the shop, but he has to have some sort of insurance some way or another. So his options may change at that point. So are you saying that, so the premiums that he would be paying, he'd rather have that other couple $100 in his paycheck to...
Correct.
So a lot of businesses have a lot of different theories on how they're going to do things like that. Some businesses are saying, well, you know what, we can't necessarily afford to pay someone's entire premium, so we'll do some contributions. So I may give them $150 a month for them specifically to purchase their insurance, and you would do that directly through the exchange. Again, that would be the premiums that you're paying towards their insurance. But yeah, the person will still have to, they really thought this out. So everyone has some shared responsibility to be covered one way or another. Yes, sir.
Is there an option where an employee will say, you know, I'm not gonna go out and I'm not gonna purchase my own. So is there a rule that where, because that employee refuses to get it on his own, that we will have to provide it because it works for us?
No. If you have 50 or less employees, you are exempt. I'll have to emphasize that constantly. 96% of the businesses in America have less than 50 employees. They are exempt from any employer shared responsibility. It is a benefit for you to have a healthy workforce and competitive and possible tax credits to offer that health care insurance. On the other hand, the employee, he or herself, must have some sort of insurance. So that gives them the option to those of you that are already offering insurance that they can purchase yours, or they can go into the exchange and they can shop within the exchange. But they will have to have some sort of insurance. You will not be liable. Even those that have 50 or more, if they offer insurance and it's affordable, and I'll talk about that in a little bit, and it's affordable, and they offer it to that employee, and that employee chooses not to accept that insurance. In other words, they opt out, you know, on the forms that you have, they opt out of that insurance, and then that individual chooses to go to the exchange and purchase insurance and applies for what we're going to call subsidies or premium credits as an individual. It's going to trigger the government to then contact you, or contact those businesses with 50 or above, ask, do you have health care insurance? Yes. Did you offer it to this individual? Yes. Is it affordable? Yes. That company is exempt. This person will not get the subsidies. They will have to pay whatever the cost is for that insurance. I saw another hand, I thought up front. Okay? So this is gigantic. I don't want to overload, so please, if you have a question, feel free to ask it. I don't mind answering the questions. You're really the easy crowd because you are exempt.
You have a question?
Oh, there. I knew I saw a hand.
Back to the employee getting that benefit of the extra payment if he doesn't choose your insurance and he goes out and gets his own or has his own through his mom or whatever. The monies that you're paying him, does that go towards that tax benefit that you're going to get?
Yes, it does.
Okay.
Because you're paying a part of their premiums.
So we have to track all of that.
Well, actually, the exchange will track it. See, because you'll be paying directly to the exchange for that person to offset that person's premiums. So yes, depending, and I'll talk about, whether you qualify for tax credits or not, but it will trigger person's social security number, person's workplace, all the other information, and you are contributing $100 towards their premiums. And you can take out their premium payments directly out of their pay and pay it to the exchange also, even if they don't purchase it directly from you. So you can keep track that way. Yes, ma'am.
When you talk about an exchange, I'm visualizing something with pillars or what is, is it going to be a website? What is the exchange?
Yeah, so we are talking virtual, okay? So basically, and I am going to talk a little bit about that, but I don't mind going into that now. But the exchange will be a group of insurance companies that are competitively bidding for your business, okay? And there are some rules within that exchange for those insurance companies that participate on what they can do, what they can't do, and the types of offerings that they offer through the exchange must be approved by the government. So by the end of this month, all of the insurance companies that want to participate have to give blind bids to the government.
Will there be more than one in Ohio, or are they?
Okay. Well, the states have had an option. They can manage their own exchange based on insurance companies that are in their state and baselines from that. Or if they opt out, which the state of Ohio has chosen to do, they opted out. So now you are still covered under the federal exchange. So the way that works, so I'm with the federal government. When the discussion first came up, they said, well, people ought to have the same options that Congress has. Do you remember that? Okay, well, what that means is we in the federal government, when I came on board and it got to the healthcare part, they sent me to a site and they had all of these different insurance companies that were there that SBA was saying, here are your choices. And then I had to decide which one I wanted. There was, and I must be honest, there were so many in there, I got tired of looking and researching. I didn't know that there was a comparative tool that I could have said Anthem, Blue Cross, GEHA, and it would put them all up together and I could look at premiums, I could look at deductibles, I could look at, waiting, I could look at everything, but I didn't know that. I got lazy, so I went straight to Blue Cross Blue Shield, paying $197 every 2 weeks for a family plan, and because they said that they had dental, I was like, oh yeah, great. I'll just pay that instead of getting a supplemental dental. But what I found out when my son went to get his teeth cleaned and I got a $300 bill was that the dental only covered if I was walking and I tripped and I hit my mouth over here and broke my tooth. Then they'll pay a portion of those services. So once the open enrollment came, I ended up finding another insurance company in that pool that my premiums were only $97 every 2 weeks. And I also was able to purchase a vision and also a dental plan. So my whole payments now are $130 every 2 weeks instead of $197. So that's what's going to happen in this pool. You're going to have a lot of different choices. They'll be broken down into, it'll be percentages, 40%, 60%, 80%, 90%, and that is the price, the portion that you're paying as an employee for the premiums. There was a question here first.
Do you know when you're managing the pool, if you're picking what you want, will it move towards doing away with the in-network, out-of-network
Man,
coverage?
I doubt it. I doubt it very seriously because there'll be PPOs in there. That's what I'm with now. I'm with the PPO. That's why my insurance changed. And it worked out because all of our primary care doctors and, some of the specialists were in that network. So it worked for us. And now that my wife is a cancer survivor and has had many surgeries over the past 3 years, just had total hip replacement surgery just 3 weeks ago. And what has happened is that the payments are much better. The claims are getting, filled quickly. And because I'm also covered under TRICARE, which is a military insurance, TRICARE doesn't pay very much if you have another insurance. It really does not. But between the two, I'm not paying much out of pocket. And this is what we're going to call cost sharing. I'll talk a little bit about that. That's really more on the individual side, so I don't have a lot of slides to talk about it, but I do understand it. There's another question. Yes, ma'am.
Is this going to be set up similar to the cafeteria plans that we have now? And is it still going to be tax deductible is it still going to be pre-tax to the employee on their paycheck?
Yes.
Okay.
Did everyone hear her question?
No.
Could you say it again loud?
I said, is this going to be similar to the cafeteria plans that we have now? And is it still going to be pre-tax to the employee when it comes out of their check?
And the answer to that is yes.
Okay.
Yes. Okay? Okay, so everything depends on the size of your business. If you have 10 or fewer, if you have 11 to 24, if you have 25 to 49, and obviously 50 and above. Okay? So all of you mentally put yourself in whatever category that you're in, and then I know that there were a couple in here that was close from here to there. Okay? So, I'm sorry.
Just a quick question on that. If, say we have, right now, we have probably 16 people that are eligible, full-timers, but we only have 7 that is elected to take insurance. Which bucket do we put ourselves in?
16.
Well, you are in, whatever your total full-time or full-time equivalent is, your concern, you don't have any concern until you get here.
Yeah, no, I understand.
So it really doesn't matter. What are your total full-time employees or full-time equivalent? And you guys are really making this really easy because I'm going to be able to jump through some slides that are coming up. But a full-time equivalent means if you have for this purpose, not Department of Labor, not the state of Ohio, but for this purpose, full-time employee means someone that works 30 hours a week. If you have a lot of part-time employees, then you must add those employees' hours up to come up to an equivalent of 1 FTE. So if you have 2 part-time that work 15 hours, that equals 1. If you have 3 that equal, whatever 3 into 30, 10, that will equal 1. And that is for the purposes of trying to determine whether you must offer insurance to your full-time employees, not part-time.
Does that include temporaries that you get through a temporary agency for seasonal employment?
No.
Okay.
If they're temporary, they're part-time, correct?
Yes.
Are you saying that they're working full-time?
They're working full-time, but through an agency.
Seasonally?
Yes.
Okay. I will talk about that, so if I
Okay.
can put that in the parking lot, okay?
Okay.
Yes, sir.
What about if people are working 50 hours a week? Does that increase your FTE count?
No. Okay. Yes, ma'am.
You said if you have your full-time equivalent determines if you qualify to be, if you're over 50 with your full-time equivalents, you have to offer insurance, but you only have to offer it to full-time employees?
To 95% of those full-time employees. So let's say you have 40 full-time employees, but yet you have 20 part-time employees. It gives you a full-time equivalent of 50 employees. That means that you, under the rules, must offer healthcare insurance to those 40 full-time employees, 95% of them. And that excludes you or your family, you know, in those numbers. But you must offer it. Although you have a lot of part-time employees that took you over that limit. Now, 95% and you have to offer. They do not have to accept. You must offer, and it must be affordable. Okay?
So if you have more than 50 full-time equivalents, but all of your employees are part-time, you don't have to offer them insurance?
No. No. So if you had 100 part-time employees, and I have to assume if you have 100 part-time employees, you have some full-time employees because you have to have some sort of management, you know, through all of this. So if you only have 3 full-time employees and 100 part-time, you must offer healthcare insurance to 95% of that 3, which means what? 2, actually. However it would calculate out, it would probably be all of them. Well, you should really. But if you had 10, you'd have to offer it to at least 9.5 of them. Okay? I think that you'll find a lot of the questions that you have will be answered as we go through, okay? So let's talk about the small business healthcare tax credit, which all of you may be eligible for. So 10 or fewer, and the way that these slides are made up, I'm going to talk about 10 and fewer and 11 to 24, because those are the only 2 that are eligible for a tax credit. Okay? So those of you with over 24, you know, drink some coffee or something for a second. So basically, if you offer coverage to your employees and you have an average salary that is below $50,000, so when you aggregate all of your employees, if their salary is below $50,000 and you contribute at least 50% towards their premiums, then you may be able to you'll be eligible for a tax credit on the premiums that you pay. And that is a sliding scale that goes down to if you have fewer than 10, you can be eligible for the entire 35% tax credit, but the wages have to be less than $25,000. So it's a sliding scale depending on, you know, once you get to 10, that wage, if it's $30,000, then you might only get 32% of that tax credit, okay? And so there'll be more information, there'll be calculators out there with Human Health Services that hasn't come out yet, but they're planning on giving you calculators to be able to do that.